Welcome to the A New Insight podcast, empowering and inspiring your journey to optimal health. Hosted by Dr. Supatra Tovar, clinical psychologist, registered dietitian, fitness expert, and author of Deprogram Diet Culture. Rethink your relationship with food, heal your mind, and live a diet-free life. I follow my guests' journey to optimal health, providing you with the keys to unlock your own wellness path. Tune in and evolve with us. Hello, everybody. Welcome back. I am very excited to have my dear old friend, clinical psychologist, and now newly published author, Dr. Richard LaBrie, back on the pod today. Hi, Rich. How you doing?
Good. Hello, Supatra.
I'm very excited to have him back, and I'm going to read a little bit about him so that you can remind yourselves he was our very first guest on the podcast. And then we're going to dive right into his questions and grill him about his new book. Dr. Richard LaBrie is a clinical psychologist whose work bridges psychotherapy, creativity, and the deeper questions of human experience. A longtime practitioner, musician, and observer of the human condition, his clinical work informs a nuanced understanding of emotional transformation, vulnerability, and resilience. He is the author of The Alchemy of Blood, his debut poetry collection, which has received strong critical acclaim for its raw honesty, psychological insight, and fearless exploration of the darker and brighter dimensions of being alive. Organized around Carl Jung's 4 stages of transformation, the collection traces a journey from despair and fragmentation toward awareness, meaning, and hard-earned hope. Dr. LaBrie was our very, very, very first guest on the A New Insight podcast. We're so excited to welcome him back and discuss how clinical life, creative voice, and personal reflections have come together in this powerful new work. Rich, welcome back.
Thanks. It was fun. Wait, how long ago was that we did our first one?
I believe it was like 2 years ago.
Wow.
It was a while ago. And it's so good to have you back.
Thanks for having me.
Rich came in pretty last minute to be our first guest and really was just going with the flow. And it was a wonderful exploration of his work in psychology. So now you're coming back as a published poet, which feels, and it's a different creative turn for you. So I want to know what feels different about your voice, your perspective, or your willingness to reveal yourself.
Well, I guess, in our work and the way I approach psychotherapy, it's always been clear to me how the arc of our lives or of our personal development is tracked in narrative. We think of our lives as stories. We express ourselves to our therapists, and my clients express to me, and I'm sure to you, as a kind of a story. And so when clients bring to me their journals and sometimes their poetry, it can be quite powerful, and it can be a window into their lives at that part of their life, whether it's from childhood or teen years. And I started writing poetry about 14 or 15 years ago to sort of vent some of the things I was feeling as I was training and working in suicide prevention. I was on the lifelines and in early training as a psychologist. And, it was interesting. I was a writer in my former life. I was a filmmaker. And so poetic lines would sort of drop into my head, and they were sometimes reformed by me into something that, I don't know, helped me process things. And then that grew over time.
Wow. Well, give me a picture of the type of poetry you were writing then and how that has changed over time. I mean, you can see a lot of the work that you've been doing with your clients. Through this poetry, give me a picture of how it's evolved.
Well, my old accountant who's retired now, Jay Brecker, and he's a published poet. He told me after he retired, he started writing poetry and he got very serious about it. And so when I wrote a few early on, I communicated with him, and a psychologist or two were writing, and we started communicating. Um, and I think the early ones were informed directly about my internal experience and how it resonated with some of my clients. I don't give away any client material in the poems. They're fully creative, but over the last 5 or 6 years, I wrote a lot more frequently, and I think my style started to fall together. But it's not pre-planned. I think a certain line will drop into my head. It'll make me laugh, or it'll just seem like an odd collection of words. And then I'll ask myself, where did that come from? Sometimes it's emotional. Sometimes it's influenced by something happening in the world. And then I look at it as a piece of craft. What can I make of it? But while I'm expanding it, I'm usually in kind of a creative trance and sort of a flow state. It usually happens early in the morning before anyone's awake. And sometimes they come out as one piece that needs to be edited, and sometimes it takes weeks to put them together. So far, that's my process.
I love that. And this poetry book, The Alchemy of Blood, it follows Jung's 4 alchemical stages. So when you look back at the structure now, did the transformation emerge intentionally, or did the poems themselves reveal that psychological arc over time?
Well, when I finally had enough for a book, and I didn't know I was going to write a book, I was just writing, and I sort of, I'll talk a little bit about something that happened in the therapy work that helped with this. But I looked at all of the poems, and I felt that there was some disparity, some wide disparity to them. And I mentioned that in the preface of the book. But then as I started to look into the underside of each poem, like what is the narrator saying? And the narrator's not always me, and I'll talk more about that. I saw growth if they were ordered in a certain way. And there is a poem called An Affirmation of the Alchemy of Blood. And that title that poem had been written a couple years ago. And suddenly I started thinking about Jung and alchemy, and I'm interested in change and transformation, as I think we all are who work as psychotherapists. And so I lifted out The Alchemy of Blood. I started looking at the 4 stages, and I realized I could shuffle the poems into those 4 stages. And if you really look underneath, like I said, I think it becomes clear that Nigredo is blackening. It's the ash. It's the first big fire. Albedo is, or albedo, I'm not sure the pronunciation, is rebirth. And citrinitas is transformation. And rubedo is, we might call it enlightenment or wholeness, or even self-actualization. And but at the same time, many of the poems are kind of dark or funny or raw or edgy, but they can still have an enlightened completion to them in the 4th section. It fell together. It seemed to work, so I stayed with that.
Wow. Yes, there are some really dark poems. If you're looking for light and fluffy poetry, this is not light and fluffy, although there are some really funny ones, and then it does transform as you read along. And many reviewers, me included, I mean, I'm not necessarily a reviewer. I didn't review this book, but you've had reviewers describe this book as raw, unguarded, and emotionally fearless. I have to agree with that. So, as a psychologist who's trained to hold boundaries, what is it like to step into that level of creative exposure?
Mm-hmm. Yeah, and it's somewhat related to the I not always being me. In the preface, I say the I's not always me, but sometimes it is, but who cares?
Mhm.
And I want to invite the reader to, just like when we listen to a pop song, make the story your own more than wondering what my intention was. And I hope the poems do that, and I hope the readers can do that. But I also know that in reading it, there's an exposure. People will know more about me just from the tone, even if it's not narratively accurate to my own life, and many of them are not. Um, One of my clients is a poet, and part of this book's acceleration came from our psychotherapy. And she had shared with me her book, and it was a part of our work that she wanted to explore. It was a part of her strengths, her creative strengths. She was working on other things at the same time and going through a difficult time. She's an older adult. And she asked me if I ever wrote, and I shared a poem with her. And it became this ping pong over a 2-year period of exposing our creative work within the trauma work that we were doing. And it was surprising to me to sort of share that, but I would always check in with her, and she was open to it. It was something that she wanted to do, and it kind of grew from there. And as people brought in their own poetry, I would share a little bit, they would share a little bit. And as she shared it, she also asked me if I had ever done any writing, and I shared a poem or two, and it became a part of our work. This is not a part of all of my clients' work. Some of my clients, this would not resonate with. So I'm very careful. When you mention boundaries, I'm still working through clinical boundaries, with each client. And through our reading of each other's work, we would find ways back to her trauma work. We would find ways to discuss her strengths and her goals in terms of continuing her writing. She's a major project she's working on. And it also enlivened me to continue my work, having somebody with such a sharp eye look at it and what it was causing in the therapy to grow. It gave me confidence in the power of the medium. So, and there are other people in my practice who I would never share it with, and don't even know anything about my side work, creatively. But there are a handful who do, and there are other people who write. So in terms of boundaries, I make it clear in the book that this is not a psychology book, and these are poems for people to read, and not a substitute for psychotherapy or anything like that. I firmly believe we're allowed to have other lives besides as psychotherapists. So.
And I'm curious about that. I mean, yes, boundaries are something that we work really hard on, and we have to be very cautious about if we do self-disclose, if it is in the benefit of your client. Now you are kind of out there, you're in a book. What are you afraid of showing or revealing? Is there any part of that work that you're a little cautious about if a client were to pick up your book and read it?
I think the only thing I'm always afraid of as a creative person is the kind of read one might take that is so concrete that they would not recognize that there's metaphor, that there's symbolism, that there's even humor in a piece of work, whether it's a film, a short story, a song, or a poem. But I'm confident I could handle it. I work with people usually for a long time. We have a pretty deep relationship, and I'm pretty open in my communication. So if somebody says, "I didn't know you were a writer. I picked up this book, and this poem called dot 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 really offended me," I would just turn it into part of the clinical work and work from the transference that created. There's some harsh edges in some of the poems, but they're also, depending on what lens you look through, they can be funny.
Yeah,
But
absolutely.
humor is not always what people want to bring into the therapy room, so I'll have to be careful.
That's true. And, some of this work is based off of work with your clients. How were you able to massage that so that their confidential information was not revealed?
Oh, um, it's interesting. There's hardly any of that. I mean, I think about, there's a poem in there called "The Fragility of the Dahlia Stem" in the psychotherapist's office. And even if you read that, that poem is about how, in working with complex trauma and clients who've been severely abused or trafficked, what I'm speaking to is how the therapist has to really contain their own rage at the abusers. And there's this dance you do that, when a therapist expresses that feeling, sometimes it's very validating to a client. But if the therapist really feels it at a deeper level, it can separate them from the clinical experience. It can abandon the client to the clinician's own emotional state.
Mm.
And I wanted to explore that in the poem. So that poem is probably the most psychotherapeutically focused, but it doesn't really address a specific client. Any of the other poems that lean into that direction are composites,
Yeah.
or fictional, but based on kind of a thematic arc that I've felt in my career.
Yes, and I think that a lot of clients, if they were to read something like that, not just yours, they might be able to see themselves in certain things and be able to draw some kind of message, or message of healing even
Mm-hmm.
from that work. So I think that's very important for us to put out there, of course, in the most ethical and confidential ways. One of my favorite poems is Not Quite Bipolar. I love the name. It captures the tension between intensity, expansiveness, creativity, and the question of whether something is pathology or just simply being alive. How do you think about the line between clinical diagnosis and creative temperament?
I'm so glad you asked that question. Having come from the creative world, and as a musician, as a writer, as a filmmaker, um, there is an intensity that it takes to create anything from scratch. And yet, in the DSM, and sometimes in the minds of clinicians who don't understand the creative world, there's the mistaken impression that someone who stays up all night to finish a novel, or loses themselves in a trance to finish a painting or work on a record, they might label that as manic behavior, and put it together with, say, a client who comes in and has a very strong sense of themselves and strong opinions, and maybe they speak quickly, maybe they're very confident. I actually had a client like this many, many years ago who came to me with a diagnosis of bipolar. And that person did not have bipolar. And when we traced where the diagnosis came from, I think she had rattled the feathers of a clinician at a very medically oriented place, let's just say.
Mm.
And she was on medication that was harming her. And through our work, she worked with her physician, and she got off of those medications and changed to, a simple dose of something that helped with her anxiety and her depression at the time, and then eventually moved off medication, I believe. She was a strong-minded, creative person and a survivor of some difficult things. And I've come across that more than once. So it's just, I wrote the poem is all one sentence. It's one big chunky paragraph that kind of is written in a sort of hypomanic kind of tone on
Mm-hmm.
purpose.
Yeah.
And it's a bit of an argument on both sides of the debate about what constitutes bipolar or manic behavior and what constitutes just committed strong-mindedness or expansiveness
Exactly.
and energy. So it was a fun one.
Yeah, I think you and I tend to veer away from really getting into a diagnosis unless we absolutely have to, because I think that
Mm-hmm.
it tends to pathologize and it tends to not, people don't just fit into these neat little boxes all the time. And I think it does them a disservice if we are to just kind of shove them in there. And especially with a diagnosis like bipolar, there's so much stigma behind it, that and borderline. And I just feel like that doesn't necessarily help. It obviously didn't help this client
Mm-hmm.
thrive. And your work with her did.
Mm-hmm.
I'm wondering if you wouldn't mind reading the poem.
Not quite bipolar. My eyes are too big for my stomach, and I see things inside that I then want to manifest. And I want too much of all of that. And my ideas are flighting around, and I'm wanting to turn them into colorful solids. And my pressure is often mounting, but I sleep okay, and I'm only sometimes irritable. And human hands are amazing, and so is the whole body, and nature too. And how can one just sit and slump and tune out when there is all this emerald, shiny beauty? But maybe I have the sickness and maybe I don't. Or maybe this is simply an expansiveness that's necessary to just get through it all. No, necessary to dream it, see it, walk it, grab it, be it. Them, you, me, us.
Ugh, love that poem. I think I can relate to that. It's just like when you're just feeling so alive that everything's just, buzzing around you, and then wondering, am I nuts?
Right. And then what are the social pressures about that? If you're around people, if your particular local tribe is 9 to 5ers, nothing against them, but they have a controlled life that helps them to thrive in the sort of guardrails that they keep. Are we judged by them? And then further, are we judged by a clinician, whether it's a physician or a psychologist or a therapist? I'm with you. I don't lean towards diagnoses. And I know you do excellent work with all kinds of clients that we're trying to treat the holistic self of the person in front of us.
Mm-hmm. Yeah. And I think you do a great job of it. For those of y'all that don't know, Dr. Richard LaBrie was my pre and postdoc supervisor. He actually helped launch Baby Psychologist into the world, helped me learn about private practice. So I've learned a lot from Dr. Rich. And I think most importantly, how to treat clients through a lens of humanity and, just shared journeys through life. I really think he's fantastic with this and certainly is one of the experts out there in treating trauma. We're going to come back for the second half of this podcast and delve into this some more and pick Rich's brain because it's vast and amazing. So I really hope you all come back. We'll hear a little bit more poetry in the second half as well. Thank you so much, Rich, for joining me for this first half, and I look forward to talking with you for the second.
Thank you for the indulgence.
Absolutely.
Thanks for tuning into the A New Insight podcast. Please remember, the contents shared on this podcast is for entertainment purposes only and does not constitute medical advice. You can find us anywhere podcasts are streaming, on YouTube at my.anu.insight and at anu-insight.com under the A New Insight podcast tab. And follow us on our socials at my.anu.insight on Facebook, Instagram, TikTok, and Threads for more updates. Tune in next time and evolve with us.